Happening now, March is Colon Cancer Month, and one upstate man is sharing his story with us and hopes he could potentially save someone else's life. Anderson native and actor Chadwick Boseman tragically passed away in 2020 after battling colon cancer really in private for 4 years. Fox Carolina's Zach Prelutsky live in our newsroom tonight.
And Zach, Chadwick's death really brought a lot of awareness across the entire world to this specific disease.
Definitely, Cody, and a doctor from Prisma Health I spoke to today says he's actually had patients come in over the last year and a half to get checked out specifically for colon cancer after hearing about what happened to Chadwick Boseman. And it's that early detection they're stressing, and the story you're about to hear is why.
There's nothing like hearing those words to say that you have cancer.
That was the reality for Carlos Galloway in February of 2021 when he was diagnosed with colorectal cancer, also known as colon cancer.
This is not a disease of old people. This is not just a disease of men or women. Anybody can get colorectal cancer.
Only in his mid-40s, Galloway started to have some symptoms like bleeding from places you shouldn't be bleeding. Couple that with the family history of cancer, he decided to get checked out.
Those experiences kind of prompted me to take action with it.
Thanks to early detection, Carlos's cancer is currently gone from his body after surgery. Colon cancer is one of the leading causes of cancer-related deaths in the U.S., but
in the earlier stage of survival can be greater than 90%. All right, and that's fantastic for having a diagnosis of a cancer.
As more and more people under 50 are facing a diagnosis, that's why Dr. Cedric McFadden says it's so important for people to get checked out if you don't feel good.
You know your body better than anybody else. And so recognizing when something isn't right, bringing that to the attention not only to your family members or your friends, but to your doctor, and really holding your doctor accountable.
Just over 1 year after getting the news of his cancer, Carlos is still spending time with his family and walking the beach with his grandkids.
I feel very fortunate. My outcome that I have right now is not like everybody else's.
Now, when getting screened for colorectal cancer, a colonoscopy is probably the most widely thought of method. Now, Dr. McFadden says there are some other ways to test for that cancer, although a colonoscopy may be necessary, especially if you have symptoms. For now, reporting live in the newsroom, Zach Prelutsky for Fox Carolina News.